Reiki is unconditional pure love from the universe. When it comes into an operating room or into really any situation where it's being administered, it's changing the vibrations of the person that's receiving it.
I feel that we are all energy, surrounded by energy. You can call it your soul, prana, life force, whatever those words are, whatever people want to use. But we are energy beings, and I believe that some people can tap into it. They can channel it, they can draw from the higher energy, if you want to call that God, whatever you want to call it. They're a conduit of it, and they're able to focus it on you, and it seems that what you need is where the energy seems to go intuitively.
You know, I became to learn a little bit about, energy healing and modalities that actually could help patients, largely initially to prepare for surgery. So how do you get ready, for this big experience you're about to have? The traditional medical things we talk about is, don't take blood thinners, really if you're smoking, stop smoking. But that's not what patients mean. They really want to know, how do I get ready? How can I be prepared for this big experience that I'm going to go through? And that's where I began to learn about Reiki as a practice and as something that can be used for patients prior to surgery and during surgery.
Dr. Feldman had actually told me to talk to Raven about having her come with me for chemo, and it was extremely comforting to have her there. And it was very relaxing. The Reiki was extremely relaxing.
The diagnosis that I received was DCIS, which is ductal carcinoma in situ. And he said, I'll need to see you early next week. And so I went into his office to discuss what my options were. And the interesting thing was, when I came into his office, he had a Reiki book on his credenza. And I just said to him, oh, I love Reiki. And that was that. I didn't think too much of it. I sat down and he went through all the options that I had. He spent a lot of time with me. And then at the end of it, he said to me, just quite in passing, you can have a Reiki practitioner in the OR if you'd like. And I thought, yeah, I should do that. So I just thought that this would give me just the extra boost I would need to get me through this surgery.
I began to see, and it was, very anecdotal initially, that patients who would have Reiki preoperatively and intraoperatively as part of their treatment, they just seemed to do better. They had less pain. It seemed like the surgery went more smoothly.
If somebody has Reiki during surgery, within a few days' time, they don't even need a pain pill. And they could have had a double mastectomy, meaning bilateral mastectomy. I believe it is unusual. What we've noticed is that there's a difference between having Reiki during surgery and not having Reiki during surgery. You could have Reiki before surgery and after surgery, and it seems what we've noticed, and this is why I really think that the research will be important, what we've noticed is that there's a lot more pain present if the person doesn't have Reiki during surgery.
We need to prove it. We really need to prove it, because what our dream is and our hope is that this will be something that will not be extraordinary or exceptional for certain patients. That this will just be normal operating procedures for patients to have this option. Some patients may not want it, they may decide it's not necessary. That's fine, but I think making it more available so that patients have a smoother recovery from their surgery and can get back into their life and not be as damaged by going through a difficult experience, have less post-traumatic shock or post-traumatic change from the experience. That's really a big deal, but we have to prove it. So what we plan to do, and what we have design of a research trial already, which has been with us for a long time now, is we have to do a prospective randomized trial where we will measure outcomes in terms of the patient experience. We'll look at stress responders, things like cortisol levels, which can actually objectively tell us whether or not this is an effective modality. I have my bias. I think it will prove that it is. But I can't convince my colleagues, and I certainly can't get insurance companies to pay for these kind of services unless we prove the outcome is better.
When I was first diagnosed, it was ultimately determined that I had inoperable stage 4 breast cancer. 4 months into my chemo and the Reiki and my first scan from diagnosis, I was told that I had an amazing response to the chemo. Dr. Feldman gave me that report as I was on the way to the operating room to have a port put in, and that day everything changed for me. It went from inoperable to I was going to be operated on. The plan became giving me chemo until they felt I was ready for the mastectomy. And the cancer, which had metastasized to my lungs, continued to shrink and disappear. And I think a few months after the mastectomy, I was told that there was no evidence of disease.
I would recommend Reiki treatment to everyone and anyone who wants to maximize their healing.
The expectation at this point is that everything will go fine, because it already has. I mean, it's been going on in the operating room for some time now. Nobody's ever... And as a matter of fact, up until now, there isn't anybody that I ever worked on that died. Everybody's still here.
Having someone be present who has the ability to do Reiki, who can do energy healing, who can really be there specifically in that way to support myself or to support a loved one, I mean, I would certainly want that. That would be 100%. There's not even like a moment's hesitation. I mean, anything that I would recommend for my patients, I certainly would want myself or for my family.